record now. All right. Hello, everyone, and welcome to our Project AP programming. Share what works. And today is June 11th. That's right. So if you are on, well, it's June 11th here. It could be, 5 o'clock in the morning somewhere or 5 o'clock p.m. somewhere, but it is June 11th and 11:05 over here in Jersey. So Project AP is, we're super excited to bring back Maya Doyle, a PhD. I'm going to put that out there because that is important. No, I'm telling you, that's a lot of work that goes into that. I know that. So I'm serious about that. She's a social work clinician and educator with 3 decades of experience as a social worker in pediatric medical settings. So before we get to Maya, I just want to do a couple of housekeeping things. So let's see, upcoming in 2022, which is the year we're in. So Project AP, we're going to have the family retreat. So that is August 5th through the 8th in Aurora, Colorado. Don't go to Aurora, Ohio, because I believe there's an Aurora, Ohio, but don't go there because you would be in the wrong location. So make sure it's Colorado you're going to. So it's to celebrate the AP heroes, meet families, and spend time together. So this event is open to AP heroes and their families. So please register. That's on the projectap.org website. Also, don't forget to go to the link on the website regarding the Chromosome AP registry and biorepository. If you're on Facebook or the social media, I believe also on Instagram, there's been a lot of videos and messages about this in getting our AP families to register. So this is an annual 2022 update or registry 2.0. And the whole purpose is this is a study to better understand the disease over time. It requires improvements, updates to the protocol, and reconsenting. This is intentional to make sure you understand. Oh, never mind. I'm just reading stuff from the page. I don't have to read that, but please make sure you go to the website page. As a matter of fact, let's see if I can put a link on here in the chat. So make sure that you're in the registry. This is not to register for something, for a trip, or you didn't win anything. It's to register a lot of the medical information. It's accumulate. It's a study so we can help our heroes. All right. So if
Sheldon, I'm going to add to that we are also offering. We're also going to offer office hours. So if you need help with the registry, we're offering office hours every other Friday, and you can email me to set that up.
For a second, I thought you said you were going to offer T-shirts or something for every registration. So I'm a little disappointed, but still, I guess, okay, I'll make the T-shirts. Okay, if you don't know me, my name is Sheldon. I'm a dad to AP hero Josephine, and I'm part of the Parent Leadership Board, as is Katie. And we're super excited you can join us today. So we really hope this program adds value to all the AP heroes. And if any of you on this Zoom call have any ideas you want to take to action in Project AP, we really invite you to be involved because we're only as successful as the volunteers' involvement. And I want to give a shout out to all of our AP volunteers that really make a difference and help to keep us moving forward. So without further delay, I'd love to turn it over to Maya Doyle. And today's topic is going to be planning for the future. And hopefully that's still the topic. I mean, you can make any topic you want up. Go ahead. Is that what you want it to be? Anyways, I'm going to mute, and I will jump in if I see something maybe in the chat or so forth. So, all right.
Thanks so much, Sheldon. And I have the chat open as well. I'm going to try to keep an eye on it as we go, but I'm going to also rely on my colleagues here to help me if I miss any of your questions. As I'm going through things, I am going to share some slides so we can walk through a little bit. But If things strike you as we're going through, please put things in the chat. We're a small group so far online, so we can also, unmute and turn on cameras in a little bit, and I can actually see you and have a conversation. So, and thanks those that are joining on social media that aren't here on Zoom with us. Hopefully this is helpful for you as well. Let me share my screen. So hopefully you can see, can people see my slides? Can I have a thumbs up? Excellent, thanks guys. So I'm talking today about healthcare transition, which is part of planning for the future, but I'm going to talk about a few things beyond just healthcare. But of course, that's my background is really in pediatric healthcare settings. So that's where a lot of this derives from. But we're going to talk about some things beyond just healthcare, about education, some legal things, other pieces like that to think about as your AP kids are getting bigger. So I've been a faculty member up at Quinnipiac in Connecticut for about 8 years, but before that, my background is in pediatric social work since, oh gosh, about 1994 across all kinds of general pediatric settings and in pediatric nephrology, kids with kidney disease. That work led me into working with some rare disease communities. And then I think I met the AP community back in 2019. Sheldon and I were discussing how blurry things are since the pandemic. We don't know if we met in 2018 or 2019, but whenever we were all together in New York City, those of you that were at the big meeting in New York City, that's when I first met all of you. I did get to meet some of you also last summer in Denver. That's been my only journey basically beyond my house in the last 2 years. So that was wonderful to be together with folks there. So that's my background. I also want to give a shout out. She wasn't able to be with us today. I hope to bring her to future meetings. My colleague, Lynn Davidson, who is a pediatrician up at Montefiore in the Bronx, which is where I've worked for a number of years. She also does a lot of work with the American Academy of Pediatrics, advocating for kids with developmental disabilities. We've spent a lot of time talking and writing together about the transition from pediatric to adult healthcare. And of course, trying to think about what does that mean for kids with intellectual and developmental disabilities. And in putting this together for all of you, thinking about both the sort of health related and neurology related side of things and the sort of developmental pieces, trying to bear all that in mind so I can give you some good suggestions. So the reason I'm doing this today is that planning early for that transition from pediatrics to adult care is super important. The general advice we give is to start talking about that when your kids are 12 or 14. Do we have any 12 or 14 parents with us today? Right. So I know it seems early, like, we think 18 or 21 is often the age where some legal changes and medical changes are happening, but talking about it early, and we'll talk about why that is super important. And we want to think about what we can do for our kids in order them to be as independent as possible, as knowledgeable and as safe as they can be, or as we can provide for them, right? As parents and as caregivers with all the other team members that we may be working with, the caregivers who may be taking care of them. I will talk a little bit about some of the legal and financial issues and just thinking about how we build that team around our kids. So just so you sort of know the language that we use when we talk about transition and healthcare transition is this idea that in a really planned way, as someone is moving out of childhood into young adulthood and adulthood, that we are planning to move them from one system of care to another. When we talk about transition, that's all the preparation work. And that's really a lot of the work that we all have to do together to help get ready for that moment. The actual transfer is when you actually change care from, say, a pediatric to an adult neurologist, or perhaps your PT and OT team is changing. Vocational things and educational things may be changing. So there's that actual moment of transfer when change happens, but there's also all this preparation that we're doing. And I would suggest also, if you have multiple specialists and folks you're working with, you don't want to do all those changes at the same time. So we want to think about how we stagger that and sort of build that into a plan to move us forward. This has been a topic I've been talking about since the early 90s. And even in the early 2000s, when I started my career at Montefiore, we were just starting to talk about this idea of getting kids ready for the movement from pediatric to adult care. It's become much, much more resourced in the last decade, I would say, and there is an incredible amount of resources and checklists and tools out there, and I'll share some of those with you today. But, you know, it's getting better, but there's still a lot of work to do on the family side. We know when we have these conversations and when we start these conversations early, they make a difference. It helps cut down on medical complications because folks aren't getting lost between pediatric and adult care. We don't have a gap in that care. It's lower costs, obviously, on the healthcare provider side, but also on the family side if you're not having unneeded hospital visits or emergency room visits because you've got consistent care. For those who are, you know, responsible for taking their own medications, adolescence and young adulthood is often a very challenging time. I mean, I think it's a challenging time no matter what. We know having these conversations is part of helping make sure that medication adherence doesn't get lost, the treatment experience doesn't get lost, and ideally bringing down some stress. So that's why we want to start these conversations early. And there's two sides to that. There's three sides, really. There's the side of getting the kids themselves ready for that change. There's the side of getting parents ready for that change, because it's changing how you're thinking about your kids and their place in the world and how they're doing and who's supporting them. And you also want to start thinking about the systems of care that you're working with. So not just your healthcare and your hospital care, but also and your clinic care, but also on the educational side, right? How are things shifting within the educational system as your kids are 16, 18, 21, 25 onward? And there's all sorts of other pieces of legal and housing and all that good stuff. So starting those conversations early is important. It's time consuming. There are many systems, there are many providers. I don't, you know, you all can probably put in the chat the number of different specialists, the types of different specialists that you may be, you know, encountering and working with now, and how are you going to make that move into getting that care on the adult side. This is hard for families because you build incredibly trusting relationships with the teams that you work with over time. And having to switch can be very scary and daunting. And you've gotten to know people, you know how systems work, you know how facilities work. Making those changes can be hard. There's also often insurance changes, resource changes that you have to think about. The same thing on the medical provider side. We've gotten to know all of you. We're very invested in taking care of your kids and you. And we have to be able to say, okay, we're going to launch you on to the next folks who we have trust in. And we're going to make sure that you're going to the best possible place for your future care. Both sides kind of struggle with that, is what we've seen in our research. And there's a lot of survey data we've collected to sort of figure out where do families and providers struggle and how can we sort of try to solve that. And this is true across systems. As I said earlier, we know this group today is right from across different states and across different countries. So your particular healthcare system, even your insurance system, may be different based on where you live. So yet the problem of sort of staying connected becomes the same. So there's a few steps we want to think about in terms of getting our kids ready as they're becoming older and getting ready to move into different systems of care, right? Thinking about their own level of independence, their own level of communication, and that can be quite different depending on the diagnosis and your particular young person in terms of what they'll be able to do for themselves, what you'll be doing for them, or what services you might be putting in place for them. But you want to always assess, and I know from meeting and spending time with the AP community and others, right? We're always thinking about what are their strengths, what are their abilities, and we're going to talk about shared decision making in a little bit. We want their input in any way they can give it to us to tell us this is what I want, this is what I know, this is how I know about myself and my own care, or can participate in my own care. So we want to support as much independent functioning as possible and talking, right, and communicating with other team members and care providers. hopefully all of you are working with the team. And I know I've met some of the team members from other AP families, including doctors and nurses and coordinators and therapists and all of those folks. And I know many of you have those folks either within the school system, the healthcare system, coming into your homes. So taking that team, building those relationships, and then over time, moving that to your adult team is going to be part of the challenge. Thinking about how we share that information, how we communicate with the team we're moving on to. Certainly your medical teams will create all kinds of documents probably to help you with that and help you find who they recommend to take over the care. So for example, I think neurology is probably one of the biggest ones, right? Who are the folks that they recommend that perhaps within their healthcare network that you're going to transfer your care to over time? There are surely other types of specialists that you are likely encountering. So the same thing, how do you find that connection? Another point that we've really learned, especially for kids with developmental disabilities of different kinds, is that sometimes rather than simply shifting from a pediatrician to, say, an internal medicine primary care doctor, the idea of having a family practitioner or family specialist who's going to follow folks throughout their lifetime is often a better transition rather than simply going from pediatric to adult leap. That way you can even start younger with a family provider and stay with that person, as long as they stick around. But finding those doctors can take some work, finding people that you trust, finding folks who have familiarity with AP. And this is true across rare disease communities. Whatever your rare condition may be, right? Finding specialists who get it, who recognize this, who have some background in training. The best resource I've found in those situations is really family to family and region to region and state to state, country to country, right? Who do you know? Who have you worked with? Your families with older kids may be able to say, or with young adults, this is who we transitioned our care to. This is someone who really gets it. This is what we recommend. So building that network, and this may be a great time, I think, for us as a community to really start building that network as we're starting to have these transition conversations. So lots of pieces that we want to think about in terms of what do we know, either what do our young people themselves know and are able to share, or what do we know as parents and care providers that we want to share, right? We want to have some understanding of the medical and genetic diagnosis, of course, for those that are on different medications, right? We want to have a good understanding of what those medications are, what they do, how they're given. We want to think about, for all of our kids, what are their typical activities, right? What are their challenges? What are the things that they love? What are their abilities? What are the things they can do on their own? What are the things they need help with, right? What are the skills that they have? All of those pieces, so that we're able to put that together, not simply in a medical record, but in sort of our own thinking about this is what works for my child. And these are the kind of supports that they need. There are some excellent tools out there, and I put some links here, and we will share them in the chat in a little bit, and we'll email them out to you as well. There are some great checklists and tools. And if we were all in person and sitting around a table, I would hand these out and say, let's do them together, right? And really walk through and think about either what can my child do for themselves, or what do I do for them? What do I need to learn? What do they need to learn? All of those pieces. Now, of course, these are designed for a broad swath of kids and families at all different levels. But just as an initial tool to think about, and we can certainly think about, is there something that we want to do specifically for AP kids and families that would be useful down the road? But this is a good template to get us started. There's also a wonderful website called Got Transition. I believe it's gottransition.org. I'll share a link in a little bit to that as well. They have tons and tons and tons of resources around every aspect of transition from pediatric to adult care, both for kids with chronic health conditions and for kids with developmental and cognitive delays, so that you can kind of find the tools that work well for you. But this is a good place to start. And just here's a little bit more, just so you get another vision. I know these are probably tiny, but the questions are either my youth knows this, my youth needs to learn this, or I need to learn this. So all of these topics are covered both for kids themselves and for the adults that take care of them. And everything about understanding plans of care, understanding medications, being able to advocate for care, all of those pieces are in there somewhere. I know from meeting many of you over the last couple of years, right, thinking about what your young folks are able to do for themselves and encouraging them to do the most they can for themselves and communicate the best they can for themselves is obviously a huge priority. Knowing how to get help when one needs it. Some of these pieces may not be something that your child can do. For others, they may be well on their way to doing that. I think having that sort of elevator speech or information about this is what's going on is crucial both for parents to have, and I'm sure many of you probably have a script of how do you describe in a couple sentences, right, your child's diagnosis, your child's needs, so that you can quickly, right, express that and get the resources that you need when you have to. How can you share information when you need to? So trying to put that together is of course important. Something else that's useful, this is also from the American Academy of Pediatrics, is just having sort of emergency information all in one spot. This is something that could travel with you. On the next slide, I'll show you there's also lots of ways to do this just in your cell phone. But that idea of how do you make sure that wherever you are, right, and wherever we're traveling, remember we used to travel, you could end up in an emergency room with someone who has no familiarity with your child's diagnosis or your child's needs. So how do you keep those things in an organized way so that very quickly you have all the contacts and all the information that they would need, whether you're with them or not, or whether they're out with caregivers or school personnel or other folks. So thinking about sort of all that emergency information, important in childhood and important in adulthood. We should all have something on our cell phones like this probably. So this was from a couple of years ago, but I'm sure it's still useful information about making sure that your contact information and your child's information is easily findable in your Apple or Android phone, which seems to be what most of us have, so that you can easily share that information so EMS can find it. We've come a long way from the medical alert days. I'm type 1 diabetic, and I spent my childhood running around with a bracelet on my wrist. You can still do that. So, but that idea of how do you quickly share information in some way so that emergency personnel, can recognize what's going on quickly. Something else we actually talked about last summer when those of us that were together in Denver last year, this is a big and challenging topic, but I think it's part of transition. It's part of adulthood. It's part of growing up, is talking about both safety and sexuality for kids, all kids, but particularly for kids with developmental delays. So there are some wonderful resources out there. I put a few links here and I'll share them with you. These are conversations also to be having both with your healthcare team and with your school. We had a lot of conversations last year about what should be included even in IEPs at school to make sure that both safety and appropriate behavior by everybody is being thought about in the school setting and wherever your kids are. And we talked a lot also about some of the communication challenges that many of the kids have and what it means for you as parents to be so attentive to their behavior, their reactions to other people, to trust that, to trust your own gut if you're concerned about things. So again, tough topics, but part of something that as your kids are getting older and moving out into the world in different ways or involved with different agencies and schools and things like that, that's part of your conversation and part of your thinking. If your kids are at a communication level where they are communicating directly with their physicians, this is certainly something we talk about for all teenagers and young adults. I've got a 14-year-old, and just this year, I tried to track down an adolescent medicine specialist to start being his primary care doctor instead of a regular pediatrician, because I wanted to make sure that those conversations were happening. around things like mental health, sexuality, drugs and alcohol, all of that stuff. Now, some of that you may be like, that is so far away from my worries with my particular child, but you still want to make sure that you're working with a care provider that is listening to them, that is directing questions to them. We got a nice list in a little while about what to look for in a healthcare provider on the adult side. But I think even, with a teenager, being able to allow them to share the information that they can share, be able to listen, be able to direct questions to them, not just to you as the parent in the room, and involve them in the decision-making about whatever that may be is super important. There's some other links here to other resources around that same idea of how you can help your child be as involved as they can be in their own care. So when we're actually talking about getting ready for that transfer of care, obviously, if you've done that work to find those adult clinicians, you've worked with your pediatric specialist to sort of get all the information in one place to pass that on, that you and or your young person have been able to think about that stuff. The other piece that I think is really important, and I almost think of this as a mission statement, is to think about how you describe your child, how you describe what they want, what they need, what they love, how best they interact with others, what their talents and interests and strengths are, so that you can share that with their team, with their new folks as well. And I think that's the project that maybe will take some time on your own away from your healthcare team to think about. How do we share that information? There's going to be ongoing healthcare that everybody needs in terms of making sure that things like immunizations are kept up to date, nutrition is maintained, activity is maintained, that we're always thinking about whatever high-risk behaviors or exposures might be happening, thinking about mental health, as we talked about sexuality earlier. These are all part of ongoing healthcare for everyone, including folks with any kind of disability. So you want to make sure that you're finding providers that are being attentive to that. And you'll kind of know when it happens because you build a relationship of trust, hopefully, with that new provider that you move to, that you don't have a gap in care, that the maintenance of whatever health conditions are going on, for example, seizure control, is maintained in a stable way, that you're not having to go to the emergency room frequently to get care made, but you're able to get the care where you need it, that you're happy with the care, and that your health outcomes, right, and your day-to-day health is being maintained. I love this particular resource from Got Transition. It's geared to physicians, but I wanted you all to see it because I think it's worth reading, that this is what one should expect as you're moving to working with adult providers who may have less familiarity. I always think about, why isn't the care that we expect in pediatrics, I think, where we're pretty warm and fuzzy and try to be pretty available, everyone deserves that in adulthood too, all of us. And what does it mean for those who don't have as much familiarity with working with adults with disabilities to also provide that quality of care? So thinking about, in this situation, how they're communicating directly with your young person and with you. What the space is like that you're going into. Are you in a crazy crowded waiting room, or are you quickly in a quieter room to wait to see the doctor? And hopefully not alone in that room for then a ton of time. So, what's the space and flow of this place that you're starting to get your care? That they're really highlighting as much self-care as possible and as much determination and decision-making as possible for that person, right? And person first. It's about you. It's not about just your child. I'm saying your child because I got mostly parents here today, right? But the idea is that we want to focus our conversations, and I hope you already see this from your pediatricians, directly on your child. They are the patient. They are the person at the center. Thinking about, who else provides what kind of supports, who are the other school personnel, who are the other specialists, who are the folks that are providing all of this care. And taking time, Now, taking time is tricky in our modern healthcare world. Physicians, all healthcare providers, we go pretty fast. Visits go pretty fast. You can feel very rushed. I'm sure all of you as families think about, what do I have to bring in as top of mind that I want most paid attention to when I'm going in for a visit? And obviously that's going to continue. That's going to continue in this transition as well. Another piece that's really, I think, important for this community to think about, depending on, where your kids are in terms of cognitive and communication abilities. Some folks are going to need support in decision making. Some folks are going to, need adults and other people to be making, their own personal adults or other people to be helping with decisions or making decisions for them. This could be around healthcare, around education, around work settings, around housing, around finances, any of those pieces. There are many, many different ways now of creating that support so that it is not simply, oh, I need to set up guardianship for my child and that's it. And then all the decisions go out of their hands to somebody else. There are much more nuanced models now where we can think about what are they able to make active decisions in, whereas where do they need support? As I said, this differs from state to state. The resource here, this national resource, obviously is US based, but really goes state by state. You can click on your state, get the names of the agencies and the policies that are applicable in your state, just so you can start getting some examples about how to do that, so that you have lots of people, who can help you with all of that. And of course, we're really thinking about, often healthcare and school are the first places that we think about here, but lots of other caregivers and community agencies over time that need to be part of these discussions. And certainly there are legal discussions that you'll want to think about, things like powers of attorney and decision-making around financial issues and things like that as well. I'm not a lawyer. I'm not a finance person. I'm a social worker. I'm healthcare based. So I don't claim to give advice on those things, but I do make a point of thinking about, how do I make sure that, the families that I meet are thinking about that and getting connected to the resources so that it doesn't get lost. Because I think in healthcare, we're like, oh, that's not my area, but it is, because if you're going to maintain good healthcare over time, right, working with a strong team, this is part of the process that needs to be wrapped up with that. Another piece that I think is really terrific, and this happens in lots of different ways, and again, may have different names. People have service coordinators, care coordinators, folks who really take on sort of a role outside of your specific healthcare team, outside of your specific school, usually connected with your state or your region, where they're really making sure that all of these little pieces get pulled together. This can include all kinds of advocacy. It can include setting up services at home. It can include healthcare services. It includes things like summer camp and respite for families, for adults, not just kids. So all of those pieces, and it can include help with housing, independent housing or group housing over time. So I gave you a New York example because that's where I'm based, but figuring out within your state what is available, or within your country, in order to provide this support, I think is super important, because this is someone who will help ease that move into adult services as well. So something to be on the outlook for. And some of you may have service coordination, even with early intervention. Many of these folks are social workers, not all of them are. But that idea of having that extra ally in your corner is incredibly important. All right, I blew through that a little quickly because I wanted to make sure we had time to talk, and because I'm a fast talker too. Hopefully we covered a bunch of stuff. I want to open this up to the group that's here for questions or reflections or thoughts, and I will do my best to answer. And I'm going to turn these slides off so I can see you all again.
And I'm going to stop recording in case we have any questions here. So that way, there we go.